lecture, we're going to talk about asthma, and specifically the causes, the pathophysiology, diagnosis, and treatment of this very common disease. I want to kind of show you what's going on at the bronchial level. You remember, if you look at our pulmonary function test discussion, we looked at a flow volume loop, and what happens when you blow out air very quickly, your forced expiratory volume or flow rate goes up very quickly and then comes down, and then you take a inhalation in. And this obstruction that occurs in asthma and in COPD occurs in this area here, which is the small airways. And as that obstruction gets worse, you see a decrement in the flow rates, especially later on in blowing out. And the point here I want to make is that these are the small airways. So this is where asthma is occurring. It's obstruction of these small airways, not the large ones, but the small ones. And as such, I want to diagram what it is that's going on. So you've got the airway, and this is a very simplified version of what it is that's going on. You've got this lumen of the airway that's here, and as you may know, it is lined with smooth muscle. When that smooth muscle contracts, this lumen gets smaller. Okay? So there's two major things that are occurring in asthma, or obstruction of these small airways, is you've got some sort of an inflammatory process for whatever reason that's going on here. This inflammation stimulates certain cascades that occur, and it causes smooth muscle constriction. And as a result, the inflammation causes the lumen to get smaller and smaller and smaller, until finally there's wheezing, there's obstruction, and the primary problem is that you can't get air out of these small airways. And that is why in an asthma attack, you will see that this flow volume loop comes down and the flow rates in these small airways is almost non-existent. That's when you run into asthma attacks. Now, the severity of this contraction is going to give you the severity of the asthma attack. And how we affect this and what the pathophysiology is of this is going to determine how this is treated. So let's talk about that a little bit.
Alun-alun jepara iki kowe tak gani nganti wengi apa kowe lali
bingung ngrasani atiku pengen ketemu nganti saling kotak-kotak ganti aku ora bakal lali nanging laku alon-alon sing penting teko cari duit mas tuku ning jepara aja balik aku mesti teko
piye to dik jarine janji ning alon-alon jepara nganti wengi kok ora teko-teko to dik